Okay, so I'm back still trying to get through these questions that I've been sent, so I do apologise if you sent these in a while ago. For those of you who are new here, my name's Rachel. I'm a registered clinical animal behaviourist and I spend my time helping dogs who've got behavioural problems. This question that's come in is a very clear example of where we need a behaviour case rather than training. So the question says, I have a 12-year-old Pom. She gets obsessive with people or clothes of hers. She growls if stroked by someone else when on her lap, and it goes on a little bit. What we've got to keep in mind here is this is an established problem, okay? This isn't a puppy who has just never learned how to do loose lead walking or how to do sit, okay? This is an adult dog who is showing a response that we would class as undesirable. So there's a couple of things I'd like to unpick with this, and please do, if you've not seen any of my other videos, there is a reason why I can't give specific behaviour advice for individual dogs, okay? And that is primarily because I don't have a vet referral and I don't have the medical history for the dog, and all of us as clinical animal behaviourists work on vet referral, okay? That is for the safety of the dog involved and to make sure that we plan an appropriate behaviour modification plan for the dog. That's really important because up to 82% of behaviour cases involve pain. For those of you who regularly watch my videos, I apologise. I know I sound like a broken record, but the thing is people just don't know this. So when I look at this bit of information here, a 12-year-old Pom, that is one of the first things that springs to mind, is that we really do need to have a health check. Okay, when we look at our demographic of dogs, okay, we know that up to 80% of dogs over the age of 8, so 4 out of 5 dogs over the age of 8 are struggling with osteoarthritis. So if this dog is 12, then they may well have some element of pain. Now you might think, well, why would that explain that she only growls at some people and not others? And why is she happy being touched by her owners and not others? But there's quite a simple reason for that. And that is to do with trust and relationship building and learned responses. So if she is regularly with her owners and has been with her owners the whole time and they've been, interacting with her and they've not hurt her, you've got trust there. But with a stranger, maybe when they've been to the vets or the groomers or something like that, if they're poked and prodded, because they have to be in those situations, I'm not saying someone's deliberately done something nasty, okay, that can evoke a painful response in the dog. And then what you can get is an anticipation of pain. So if someone comes over, actually, I'm anticipating that's going to hurt, and so I'm going to grumble at you. What we do as humans is we tend to interpret this as the dog guarding us, being obsessive, okay? Whereas in the vast majority of cases that I see, actually the dog is protecting themselves. It's a defense mechanism. I want to look after myself. Now, looking after clothes and being protective over clothes, that would probably be what we classed as resource guarding, okay? And that is, again, a behavioural concern that needs support. So my answer to this is please do go see your vet and get referred to a clinical animal behaviourist for some one-to-one support with this.